My name is Walter Koltun. I'm the chief of the Division of Colon and Rectal Surgery here at Hershey Medical Center. I'm also the head of the IBD Center that has recently been established at Hershey Medical Center. I'm also the Peter and Marcia Carlino Professor of Inflammatory Bowel Disease. I decided to take a special interest from a career standpoint in inflammatory bowel disease patients very early in my education. When I was still at medical school, I became very interested in gastrointestinal diseases and subsequently did research in small bowel transplantation. I rapidly recognized that the diseases that were affiliated with intestinal abnormalities really focused on inflammatory bowel disease, and that stimulated me to then take special training from a surgical perspective in inflammatory bowel disease management. I came here after my training in colorectal surgery in Boston and established the Division of Colon and Rectal Surgery here, and then went on to fulfill my dream of having an inflammatory bowel disease center. Taking care of patients with inflammatory bowel disease has been a personal passion of mine. I think it's a special group of patients, in part because they're usually relatively young, but also because their disease affects many parts of their life that really impacts negatively their entire lives. Their families are affected, their jobs are affected, and they have a great difficulty in just leading a normal life at a point in time of their lives when they should be active, happy, healthy, and doing things like normal people should. They need special care because it is a disease process that not only needs surgery but also needs the input of many different specialties: gastroenterology, stoma nurses, nutrition, dermatology, fertility experts. And the care of an IBD patient therefore requires all these experts to come together under one roof in order to provide the best care. Here at Hershey Medical Center, our surgeons and our gastroenterologists work shoulder to shoulder with the patients. Patients will meet their surgeon relatively early in the care process because frequently surgery will be necessary. Sometimes it's for cure. Patients who have ulcerative colitis can be cured with surgery. Other times surgery has to be done under more urgent circumstances, and then it can be life-saving. But it's important to remember that the majority of inflammatory bowel disease patients will sooner or later need surgery. Surgery is one tool in the toolbox of the caregiver. That tool should be used when it's appropriate to be used. Sometimes it is the best tool. The outcomes from such surgery frequently are very, very good. There are very many unique features of how surgery is provided to IBD patients here at Hershey Medical Center. We have the most modern cutting-edge techniques. We use laparoscopy or minimally invasive surgery for over half our patients. We include robotic surgery in the management of patients with inflammatory bowel disease. We have been doing surgery for patients with inflammatory bowel disease for over 20 years, and we have the region's largest experience in the ileal pouch anal anastomosis, which is the surgery that can cure patients with ulcerative colitis. Many years ago, when I was doing research in inflammatory bowel disease, I asked myself, how could we do research in a way that would have the most impact and the most relevancy to human disease? What we started about 15 years ago was the Inflammatory Bowel Disease Biobank. This biobank stores DNA from patients with inflammatory bowel disease, as well as tissues that may be removed at the time of surgery. We then can do research looking into the genetics of inflammatory bowel disease and then correlate the findings with the actual tissues from the patient removed at the time of surgery. This IBD biobank is unique in several regards. First of all, it's the largest that contains both DNA and tissue from patients for research. Secondly, it now has been in existence for so long that we have multi-generations from the same family that have been accumulated over multiple years. We have over 1,700 patients in this biobank presently, allowing us to do a remarkable amount of research into the genetics and the causes of inflammatory bowel disease. What inspires me to continue to work on inflammatory bowel disease is the patients, specifically the gratification that comes from seeing a young patient who years earlier was sick and had their lives almost destroyed by this disease, and then to see them a few years later having a normal life, a normal family, and being successful in their career. 5 to 10 years from now, I see the Penn State Hershey IBD Center as being nationally recognized as one of the places to be for not only patient care, but also for cutting-edge research. We have all the necessary components to make that happen.